Well, you're right on time for breaking today. Good evening from where you're watching us from. My name is Joel Church and our sign language interpreter is Teresia Washira. On a day that Education CS George Magoha has maintained that he's still in charge of the ministry and he will continue to discharge all duties assigned to him by the head of state. We have a lot in line for you, but first, here are our top stories. 4 doctors succumbed to COVID-19 in the last 24 hours, with the alarm of a rise in deaths of COVID-19 in the country. Maendeleo Chapchap party leader Dr. Alfred Mutua endorsed by the party's governing council to vie for presidency in the 2022 general election. We tell you how diabetes has become a slow-moving pandemic, especially during this COVID-19 era. We start on a sad note where 4 doctors have succumbed to COVID-19 in the last 24 hours, bringing the number of deaths of health workers from COVID-19 to over 20, and more than 2,000 health workers are confirmed positive. Today, the country has lost 21 patients who have succumbed to the disease, bringing the fatality to 1,249, and 1,080 people have tested positive from the virus from a sample size of 8,322 tested in the last 24 hours. Bringing to 69,273 the number of positive cases in the country. Daniel Kariuki with the details.
The last line of defense soldiers in the fight against COVID-19 seem to be paying the bigger prize. This is after 4 doctors succumbed to COVID-19 in the last 24 hours, raising concerns over the safety of medics on the front line in the fight against the global pandemic. According to the Kenya Medical Practitioners, Pharmacists and Dentists Union, KMPDU, the 4 doctors are Dr. Emara Ashraf, Dr. Hudson Alumera, Dr. Jacqueline Njoroge, and Dr. Faith Kanjiru Mbuba.
Kulala kuamka asubuhi tumepoteza madaktari wawili. Na jana tulipoteza mmoja. Kwa hiyo ni watatu ndani ya masaa 24. Na tuliowapoteza wote ni madaktari 9.
The Acting Director General for Health, Dr. Patrick Amoth, in a tweet has also mourned the death of the 4 health workers. He's saying in a tweet, and I quote, "Today my heart is heavy having lost 4 colleagues to COVID-19 in the last 24 hours. For a country that barely has enough healthcare workers, 4 is too many a loss, especially amidst such a crisis." The KMPDU Acting Secretary General Chibanzi Mwachonda has also instructed all doctors not to risk their lives while in the line of duty till the government guarantees them of their safety. Doctors have convened a special National Advisory Council meeting for Sunday in a statement dated 14th November 2020 to discuss the welfare and occupational safety of members in the light of the coronavirus pandemic.
Madaktari wamechoka kuhatarisha maisha yao. Serikali itupatie vifaa kinga, ilipe marupurupu ambayo tunaita risk allowance. Ihakikishe kama madaktari wataweza kupata matibabu bila ya kulipa pesa yoyote.
We want to advise the government ya kwamba kuna protocols ya kuzika or to bury people who have departed with COVID. COVID iko hapa na sisi and it will be here for a long time.
On Wednesday, Kenya recorded its single highest death fatality rate yet after 26 patients succumbed to the virus in a period of 24 hours, with alarming rates over the rising deaths in the country. Daniel Kariuki for Switch TV, Nairobi.
Following a partial reopening of schools in the country, university students are now lamenting that a spike in rental prices in accommodation facilities outside the schools is frustrating them. According to the president of the Kenya Union of University Students, that is KUSO, Anthony Manyara, he's calling upon an intervention by the government and that landlords should be a bit sensitive towards tenants who are students from poor backgrounds. We'll be getting that story in just a few, as today marks the World Diabetes Day, and those living with diabetes are asking the government to allow them to use their NHIF cover for treatment. Speaking after Diabetes Awareness Walk in Nyeri group, the group has called upon the Ministry of Health together with the NHIF board to review the decision they made about NHIF card not covering the medical expenses of COVID-19 students.
Mwito ningetaka kuitana kwa serikali yetu na national government ni wajue kweli kuna COVID, na COVID ukiwa na sukari ama high blood pressure inakulemea, Ningetaka tu kusema hii kadi ya NHIF tafadhali wacha mtu akienda hospitali atumie. Juu kuna wengi wameshalipa na waja kuwa wagonjwa hata miaka 3 miaka 4. Ningetaka kuomba serikali wacha wafungue NHIF tutumie. Hata maneno ya sukari, ukiwa na sukari ushikwa na COVID, wacha wakubali hiyo kadi tutumie ndivyo mtu atibwe.
Ni chungu sana umelipa hizo miaka zote hujaitumia wakati wenye unataka sana, because kila mtu ako affected, hakuna pesa. Lakini hiyo time nilikuwa na pesa, nilikuwa ni kujiekea, then napata hizi zote zenye nilijiekea wanasema sitatumia. Jadini ziko mingi lakini hawataki kuzitoa hizo, na ni mimi mwenyewe nililipia. Unaona inakuwa ni uchungu sana. Hata nitakuwa after tumemaliza nitakuwa na change mind.
Well, diabetes has become a slow-moving pandemic, especially during this COVID-19 era. And as the world commemorates World Diabetes Day, our reporter Harry Chimea brings us the story of how important it is to create awareness, educate, and the prevention management of diabetes. Take a look.
Diabetes is estimated to have reached 48% in 2045 globally. That is approximately 629 million people. In the country, according to the Kenya Stepwise Survey for Non-Communicable Diseases 2015 report, found the prevalence of diabetes to be at 2.2%. However, there is still not enough data that shows exactly how extensive diabetes is.
Actually, most of the people, by the time you're being diagnosed with type 2 diabetes, you have lived with the disease for about 5 to 6 years. So how we can diagnose the people in pre-diabetic, because most of them do not have any signs or symptoms, is by doing your regular checks. Especially after the age of 40, you should have a fasting blood sugar. Or if you have a family history of diabetes, you should also go for the checks. Now, the signs for now overt diabetes is that you can have increased thirst, you have increased urination, you have non-intentional weight loss, you have fatigue, it affects your nerves, so you find that you're having pins and needles on the upper and the lower limbs. It affects your vision, you just feeling tired and lack of concentration.
According to statistics from the Ministry of Health, at least 16% of critically ill COVID patients in Kenya had diabetes as an underlying condition.
A big chunk of the patients who are being diagnosed with COVID have also been diagnosed with type 2 diabetes that they did not know. So that is where you're finding also there's a big percentage of patients with the diabetes.
Now, what is alarming is that an estimated 40% of Kenyans with diabetes are unaware of the condition, and with COVID-19 lurking in our corridors, this could result to another diabetes pandemic.
The COVID seems to be affecting the pancreas and causing the blood sugar to go up and increasing the insulin resistance. So you find that these patients have difficulties in controlling their sugars. Already when you have diabetes that is not well controlled, you find that you're more prone to getting infections. So if you get COVID, you find that you're getting a severe infection.
Keeping diabetes under control is among the best defenses against COVID-19.
So the key thing I would tell the patients is that continue with the measures that have been advised to make sure that your immunity is up by having a proper diet, keeping physically active, and also adhering to your medication so that your sugar is under good control.
Newton Ngugi lives with type 1 diabetes, a long life condition that requires daily administration of insulin and a lot of other complications that have become part and parcel of his lifestyle.
I was diagnosed with diabetes. It was a very tough situation in my life. It was devastating. I was shocked. I was frustrated. My mental status at that point was very strained. It was very foggy. So I was wondering what to do. When I left the hospital and went back home, I assumed a state of denial, now saying that this condition is coming to curtail my studies, to curtail my young adult life.
However, Ngugi continues to share his story, and though in his championing for diabetes awareness, myths surrounding the non-communicable disease make it difficult for his quest.
These fake stories are like the myths that we hear outside there, that diabetes belongs to the rich. Diabetes is, once you are diagnosed with diabetes, you will become, your limbs will be chopped off, you will lose your eyes, you will lose. It is not the case, because once you control your blood sugars, it has been evident that you can live with the condition for as much as 50 years and beyond.
Moreover, nurses have a big role in management of diabetes, and the spotlight this year shines on them as heroes.
The nurse is the one who educates you about how to inject your insulin, how to store your insulin, and most of the time the patients feel more comfortable to talk to the nurse.
When a patient is diagnosed, there's a lot that goes into their mind. First of all, they need to understand what is happening to them and why. They need to understand the role of diet, and even most difficult is if it comes to injection.
Many times the mothers don't need to accept that their kids have diabetes. It's very hard. So we have to teach them first to accept. There is that thing called acceptance. We have to tell them that it's not their fault that their kids are having diabetes.
We are now facing a global pandemic of diabetes, and when it continues to go unnoticed, it could result to a full-blown crisis. Harriet Chimea, Switch TV, Nairobi.
Thank you, Harriet Chimea, for that story. Shifting gears now to matters politics, Machakos Governor Alfred Mutua has been endorsed to run for the top seat in the country by the Governing Council of Maendeleo Chapchap. Mutua says he is confident his party will form the next government, insisting that Kenyans are more interested in development and not mere talks by politicians on BBI.
Ni fresh. Mambo ni nini? Fresh. Mambo ni fresh. Mambo ni fresh. Mambo ni fresh. Mambo ni fresh na Mutua.
I'm running for president, and the meeting today resolved to support and popularize my candidature as the next president of the Republic of Kenya. We welcome and invite persons who are interested in vying for all elective positions in our country to register with this party and to start early preparations. Counties will all get more money than they've been receiving. The establishment of the World Development Fund is also very good because it will bring more development to the people. Devolution will be stronger, and our members have said, even just for that reason alone, they support the BBI.
Now, following a partial reopening of schools in the country, university students are now lamenting that a spike in rental prices and accommodation facilities outside schools is frustrating them. According to the president of the Kenya Union of University Students, that is Kuso Anton Manyara, he is calling upon an intervention by the government and that landlords should be a bit sensitive towards tenants who are students from poor backgrounds.
Education is becoming an expensive affair, not because of the school fees, but because of rent. Me as a chairman, I would like to say this is the directive that we are going to work with going forward. We are going to issue a demand letter to each and every private holding, any private residence, to ensure that we will demand a response. We will be seeking a reduction of rent to a tune of 6,000. If students who are attending public institutions like University of Nairobi are paying something to do with 2,550 per term, that is 3 months, in a span of 3 months. Then you, who is having a private holding somewhere, you are telling students to pay 22,500 for only 1 month. It is very outrageous. It is an extortion. It is corruption. So at the end of the day, that one we will not accept. And I want to state this categorically, that we will not accept as students. If you come to the university, you are not supposed to, apart from school fees, you are not supposed to pay a lot of money for rent.
12 minutes now past 7 p.m. Time to take a short commercial break. We'll be back with more stories. Stay tuned. Welcome back to Breaking Today. My name is Joel Church and our sign language interpreter is Teresia Washira. Moving on, Msambweni campaigns has kicked off with ODM party holding door-to-door campaigns in accordance with the Ministry of Health protocols to prevent the spread of coronavirus. This comes in after early this morning ODM lost the Mombasa County Chairman Mohamed Hatimi. Moluse Meshak with more on this story.
Following the death of Suleiman Dori, the position of parliament has now attracted several candidates who are participating in a by-election to take the position of Dori. Among them is a former representative of Bongwe Gombato, Omar Boga. The ODM chairman, Kwale County, Hassan Mwanyoha, former MP of Matuga, led the campaign for Omar Boga and asked the people to choose him because the position is for ODM. By-election is set to happen on 15th December.
Kufikia tarehe 15 saa 9, Boga atatangazwa mshindi wa kiti cha bunge cha Msambweni ambacho kimeachwa huru na mheshimiwa marehemu Suleiman Dori. Na hii Msambweni kutoka Abu na Abu, hiki ni kizingiti cha ODM. Hakuna mtu mwingine ataingia hapa ambaye si wa ODM kwa wakati tulionao.
Fatma Mathau, a grassroots women representative, encouraged voters in the area to choose a leader who will serve them without discrimination and improve their lives.
Na mtu ambaye tunaweza kumuuliza, na huyu mgombea wetu Omar Boga ni mtu ambaye anasikiza maoni ya watu, na tuna hakika tukimpelekea Raila Amolo Odinga atakuwa anamsikiliza, na pia rais wetu pia atakuwa na mtu ambaye anaweza kumwamini na kumtuma huku.
Many politicians have sent their message of condolence following the death of ODM's Mombasa chairman Mohamed Hatimi. Parliamentary reports indicates that Hatimi succumbed to COVID-19 at the intensive care unit of Mombasa Hospital. He was among a number of Mombasa MCAs reported to have tested positive for the virus. Msambweni constituency has 69,377 registered voters spread in the 4 wards of Ramisi, Kinondo, Bongwe Gombato and Ukunda. Moluse Meshak, Switch TV, Nairobi.
Away from that, WHO Director General Tedros Adhanom has lauded the quick progress in the innovation of the new COVID-19 vaccine by the American manufacturer Pfizer that was announced on Monday after months of trials. Pfizer CEO Albert Bourla has made it public that the vaccine candidate is 90% effective. Tedros has advised other countries to make sure they benefit from this scientific innovation.
This is no doubt that a vaccine will be a vital tool for controlling the pandemic, and we're encouraged by the preliminary results of clinical trials released this week. We must apply the same urgency and innovation to ensuring that all countries benefit from this scientific activity.
Donald Trump says the state of New York will not be getting the COVID-19 vaccine in the rollout that is set to happen soon. Pfizer had earlier announced that its success in the innovation of the vaccine. However, the American outgoing president, in his tug of war with the New York governor, has said the governor Andrew Cuomo mistrusted and dismissed the vaccine effectiveness. These were Trump's first public appearance since election.
The administration will not be going to a lockdown. Hopefully the whatever happens in the future, who knows? Governor Cuomo will have to let us know when he's ready for it. Otherwise, we can't be delivering it to a state that won't be giving it to its people immediately. And I know the people of New York very well. I know they want it. So the governor will let us know when he's ready.
Many thanks for staying with us. My name is Cedric Oronje, and now let's get sporty. Now, many of you may know him. I beg your pardon over there. We go straight to Manangoi, where world 15,000 meter champion Elijah Manangoi has been banned by the Athletics Integrity Unit for 2 years for a doping offense. The ruling will disqualify all competitive results obtained by the athletes since 22nd December 2019, including the forfeiture of any titles, award, medals,